Good afternoon, everybody. Thank you for joining us. Thank you to the panelists for coming here to host this conversation. Thank you to Morty Schwab for moderating. My name is Yoni Schechter. I run the newly expanded finance, data, and reporting arm of Glad Health. We do cost reports for a number of agencies in the industry. And in this cost reporting cycle alone, we have come across $1.5 billion in CDPAP revenue that we all know is now in question. From our unique vantage point, we understand, as much as anybody here, the significance of the moment and the importance of having this conversation that, while we may not want to have, is definitely one we need to have. So Glad Health is very proud to be able to be a partner in facilitating this conversation in a timely setting for all of us together here today. Thank you. Morty?
Thank you, Yoni, and thank you for everybody here coming out here today and joining us. Obviously, the hot topic of today is certainly the current ongoing issues of the CDPAP industry. So I just want to briefly ask each panelist to introduce themselves, and then we'll get right into it.
Thank you, Julian. Hi, I'm Kathy Fabreo. I'm the president and CEO of the New York State Association of Healthcare Providers. We represent home care agencies and fiscal intermediaries across the state of New York.
Hi, Brian O'Malley. I am Executive Director at Consumer Directed Personal Assistance Association of New York State, as well as our C4 arm, Consumer Directed Action of New York. And then just because I like accumulating C-Corps, when this whole thing started, we formed the Alliance to Protect Home Care as a larger entity that really is meant to encapsulate everyone and not be limited to any one group or organization.
Hi, I'm Al Cardillo. I'm the president of the Home Care Association in New York State. We represent all the different levels and types of home care services, providers, and plans in New York State. Thank you.
Hi, everyone. Julian Hagman, Vice President, Caring Professionals, LIXA, FI, Downstate. I am also the Executive Secretary, for CD Panties, for Brian's Association. I am the Long Island Chapter President for HCP, Kathy's Association. And then to throw it back one more to Brian, I'm the President of the Alliance to Protect Home Care for the CDPAP effort. So a lot of hats going on, but excited. Thank you very much for having us here to talk about the important issues at hand.
All righty, thank you all. Thank you all, and welcome again for those that are just joining us. We're going to... All right, no problem. Sorry about that. I just have a lot of ADD here. All right, so this is a question for all the four panelists here. If we can just get a quick, brief overview of the current issues going on in the CDPAP industry, where we stand today, and what the future holds for us. Julian, you're up.
Sure. I'm pretty sure everyone in this room knows the state of the situation and what's at risk and what the governor is looking to do. Going back to mid-April when there was a late budget and everyone thought that we were in the winning road, right? And then we sort of got sidelined and found out that everything was moving in a horrible direction, right? That's when we really got on our horses, got up to Albany, made our voices heard. And, starting from that, this is where we are today, right? There's lawsuits, there's delays out there happening, there's pressure happening, and all that started from that April 15th day, right? It really did. And, going and looking at the history of politics, I'm sure the governor was sitting there thinking, it'll blow over in a month, but yet here we are again. And we're not going away, and we're making our voices heard, and we need to keep that pressure on, and that's what we're here to talk about today.
So here we have a situation where we have over 200,000 people in a program that is providing extensive and in many cases extraordinary care. The implications are not only for those 250,000 people across New York, but really for the entire health system. Because as this program goes, so do the ripple effects across hospitals, emergency rooms, EMS, and really services across the continuum. So really what's at stake here is the basic day-to-day care of individuals who are incredibly fragile, who need support, and who have a mechanism to provide support that is very close to them. And on top of that is the impact across the entire delivery system. We have, almost in every community, the emergency rooms and hospitals are in crisis because they can't process patients. Patients can't get services. They can't get discharged. And so you have the complete disconnect in our government, not understanding the relationship between this program and the needs and the people and the rest of the healthcare system. Brian, to you in Atlanta.
God, I wish I was in Atlanta. Never said that before. Probably will never say it again. Yeah, I think Julian and Al summed up all of this pretty well. There's not a ton left to add in terms of where we are today. I think the only piece I would add is we have more momentum today than we have had yet, and that momentum is continuing to build. We are the snowball rolling downhill, and between the legal and the advocacy, if we all stay together, if we all stay united, if we all do the work to beat this, we will beat this. But it will take all of us, and it will take all of us working together and united because, divide and conquer is the oldest strategy in the book for a reason. It works. If we are separate, if we are divided, they will win. But right now, we have momentum. We are together.
And I would like to add, specifically within the home care sector, we have a law out there right now for a LICSA RFP to occur. They have not implemented it for several years, but let's say this is the test case. What if they deem whatever they do successful? Will they do that to another sector in home care and just continue to chip away at the programs that we provide and at the services we make sure that people are not in institutions and that it becomes an integral part of the long-term care system that could go away?
Thank you all. One of the things that was mentioned by all the four panelists is our current legal actions that we've taken so far, our lawsuits that are filed, and lawsuits that will be forthcoming in the coming weeks and months. Julian, are you able to give us a quick overview of let's start with the first lawsuit. Let's start with PMPM. Brian, we'll go to you on the SFI issue. I believe PMPM is a lot more imminent. So Julian, if you can give us a brief overview of the PMPM current lawsuit.
Yeah, I mean, both of them are sort of going in conjunction together, right? Two separate lawsuits, same day, same judge, same DA, same everything, right? So it's basically, one set lawsuit that the judge is really going to hear, but have two different rulings. It's in status quo right now, unfortunately. We're working on it. We have some things that are going on to try and ensure that oral arguments are heard, so that way we can educate the judge on not only the history, but what the program is and what's involved in it, right? This is a very complex program when you're speaking to somebody that has no idea what home and community-based services are. So getting in front and actually explaining is the key, and that's what we're working on right now.
Brian, if you can just touch on the SFI lawsuit that's been filed.
Right, and there are, I think, if it were only so easy as the SFI lawsuit, there are currently 3 lawsuits against the single fiscal intermediary. The one, as Julian mentioned, is kind of pending judicial determinations. Another I know is in federal court that actually has FI-related claims as well as Olmstead claims. They have consumers on their case as well. Unfortunately, while they are seeking a preliminary investigation, I think the arguments are set for November, and they are trying to pull that back to get an earlier hearing date. I am not positive the status of the third suit. I have not been able to connect on that in a little while. My understanding is there's, I think, at least 2 additional suits forthcoming. So a lack of lawsuits is not where we are the problem right now. I think we have a number of different venues, state supreme and federal court. My guess is everything will get appealed regardless of the outcome, but hopefully we can get this on a preliminary injunction quickly.
Awesome. One of the questions, or I should say many of the questions that have come into me over the last 24 to 48 hours and the last several weeks are from many different agencies. Some of these agencies are smaller agencies, a couple hundred. Some of them are larger, 1,000, 1,000 plus. A lot of agencies have been reaching out to me and saying, what can we do to help you? We appreciate everything you guys are doing, and we are very hopeful. We'll stand behind you. But there are a lot of agencies that are coming forward and say, what can we do to help you? How can we help you? And part 2 of the question is, for those agencies that are, per se, scared or not willing to put their names out there, what advice can we give them to better comfort them to join the fight and join us, that we can hopefully get this to the finish line where we need to be?
Well, first of all, don't be afraid to put your name on anything. In this particular situation, the goal is to keep your focus on members of the legislature who are there to represent you. You want to have your name on that. You want them to know who in their district is being impacted by something of this nature. So, while there is momentum in the legislature, particularly on the Senate side, with Senator Rivera having introduced legislation to try to unwind, roll back, the single FI, and while, I can tell you that it's rare that you have a situation that almost every legislator stands up when the budget is being presented for approval. Almost every legislator stands up and objects to the provision on the merit of the provision, not the politics, on the merit of it, knowing that their leaders had agreed to the budget deal. So, most of the time the budget goes forward and, something that looks like that, it gets passed and people move forward. And maybe there's a comment about one matter of interest. But when almost every single legislator does it, that the issue is resonating. But what can't happen is now for the budget to be over, it's parked away, they have the budget deal, and even with the efforts going on, public relations is happening up here wonderfully, happening at that level, lawsuits are going on, but legislators you can't let legislators just sort of ride that tide. They need to hear from you frequently and in volume. Between yourselves, your workers, and the families that benefit you, they need to hear that this is something that cannot be taken away, and they have to stand up for you. Now is the time to stand up. That's the threshold.
And some of the structures that the associations and the Alliance to Protect Home Care have put into place make that much easier. There are links to websites on all of the social media posts for you to react to, for you to engage with, for you to share with your staff. It would get messages to the legislature, it would get messages to the governor's office. It would engage at a different level, but we make it as easy as possible for you so you don't have to create the talking points. You can edit them, you can personalize them, and I encourage you to do so because it's those personal stories for their constituents, for their voters, that are going to push them over to making and taking action. So watch for these pieces, connect with any one of us, and we'll get you the links that you need to engage and do it as often as you need to and with as many of your patients, your workers. It's going to be important. If someone's going to lose their job and they talk to their legislator about it, that resonates. They then feel accountable for that person losing that job or for that person losing their care.
If I could just add one thing, too, for a moment. And Brian, if you don't mind me being your proxy for a moment. Brian and I spent a lot of years in the legislature as staff, as committee leaders, and things like that. We can tell you from that perspective, that when constituents are affected by something, it's important to those offices to hear. So I'm, again, just trying to work at the idea of there should be no hesitancy on your part to reach out. And Kathy laid it out very well. If you go to the Protect site, you'll find all the tools and guidance that you need. But the very simple thing is you can pick up the phone, call that office, say, I'm a consumer-directed fiscal intermediary in your officials community. Here's what's happening, and here's what we need. 2-3 minutes of a call like that simply put, will have an effect.
And I just want to echo, I can speak for myself on personal experiences with my agency, is that we've been doing a lot of these reaching out. We've been reaching out to a lot of the locally assemblymen, some of the local Senate, and every single agency sitting in this room here today presents a number of counties. Every single county, every single zip code represents another government official. It is crucial that each and every one of us, whether you think you're small, you think you're large, you think you're not going to matter, every single phone call, every single text message, every single email counts. So we'll speak a little bit later on what we want to do, but I just want to reiterate to everyone sitting here in the audience that may not think that their voice will be heard. Every single voice will be heard. We need everyone to step up as a industry, unite, and we will win.
I just want to touch on one thing about getting your name out there, right? So there's a huge stigma that came from a long, long time ago about, my agency can't be named in a lawsuit, retaliation, this, that, and the other thing. And I'm not going to change anyone's mind here today about that, any business owner. But when's enough enough? When's it going to be too late? Right? I got named in the lawsuit because I've been tired of being pushed around on the CDPAP issue for 6 years. Going in, sitting in Hochul's office, sitting in all the legislators' office. I want them to know it's me. I invite them into my office. Come on in. I'll show you how everything operates. What are they going to do? When is it going to be too late? To get engagement, to understand what's going on in the industry, to be a part of a lawsuit. Not even saying necessarily be named, but contribute to a lawsuit and have input on the way the lawsuit's being structured. The more people we get in, the more minds we have, the stronger we're going to come out of it. So just think about it. Bring it back. Think about it. Ponder. It took me a month to figure this one out. You can ask Michael. But enough's enough, right?
Couldn't have said it any better. Let's move on to some of the current lobbying efforts that we're doing today. Al, if you can just speak on what's being done currently and where we foresee the next couple of weeks, months, and our efforts on the lobbying front.
Well, really, you have this combination of the broad public relations effort that really has been being spearheaded by Brian and Kathy, and really in this large coalition, Julian, a large coalition of folks that have been doing this, as well as a very, very highly regarded public relations firm. And there are very intensive ads, very compelling ads, particularly targeting New York City, the Albany area, and Buffalo, really trying to send a message. And it's really clear that message is sort of getting there because the governor has been reacting to that message. So I think the public relations effort is really critical at its level. We talked about the litigation, but I think the other place where efforts are being aimed is at CMS. We have members of Congress that have written to the New York governor, are urging the governor to not implement the single statewide FI. We have members of the New York State Senate, the Republican minority, that have written to the governor on this very issue. We have a bipartisan group of New York State Democrat and Republican members that have written to CMS urging their review of what the state's actions are. So, I mean, you have a lot of engagement at that level. But again, I think what it really comes down to are the calls and the efforts and the grassroots that everybody really has to undertake. Because it's easy to tune out the broader things, even though they create pressure, but it's not easy to tune out your constituents, in particular those that really have incredible needs. And again, I think there is a resonance with that. The one thing I just would caution at, and I know that my colleagues here want to comment as well, is that having a legislator's support is just the first level, but having them act on that support is what's critical. Very often we go into budget discussions in offices and we'll explain the issue, and the legislator will say, yeah, I support home care, or I support this, or I support that. But when it comes down to that legislator having to define their 1 or 2 or 3 priorities, if they've got 15 things on it, they may support home care, but unless it's up here and they're going to act on it, it doesn't have an effect. You know, it's good to cultivate it, but it doesn't have an effect. This has to get to an almost unprecedented level of legislators wanting to take on the agreement that their leaders and the governor came up with to implement this and to have the will to reverse it. So that means all of us, we all have to get this to that level where they act. Right?
Yeah, I think, the only thing I would add to that, right, is when we're reaching out to the legislature, when we're engaging that, it can't just be you as the head of the agency or your team. Send it out to don't be afraid of engaging your consumers. Don't be afraid of engaging their workers, right? Send it out. We have these networks of people. Let them know. Spread, protecthomecare.org. Show them the commercials, give them the tools, give them the resources to advocate for themselves and you and the business, right? You have the relationship with them. They want to save your business. They have a relationship with you. Let them. So often I run into agencies that are really, don't want to educate their consumers. There's that kind of hands-off relationship, but that they are your best weapon. They are your best advocate because they interact with you every day, and they are going to push back more than anything. And I'll just also echo what Julian said of, when's enough, and what retaliation exists if you're running a coffee shop on 42nd and 6th, right? Like, if you no longer have an home care agency after this, like that is the alternative at this point, right? They're putting everyone out of business. What are you going to retaliate against?
I just want to echo Brian. And if anyone has any trouble, there's a lot of technology providers in the room that can tell them how to bulk SMS messages to all your caregivers and consumers and everybody. But we need that engagement, and we made it very simple on the website. Click, 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 enter name, send. It sends to every legislator. We need that to be utilized a lot more. We need hundreds of thousands, not tens of thousands, hundreds of thousands. And if there's people in this room that aren't doing it, then you're not helping the industry. You're not helping yourself. You have to utilize it. We've spent a lot of money developing it, making it very easy for everybody. And it's still not being utilized the proper way. And there's only so much we can do. You have to take it to the final, the end of that mile. I can't come into your agency and send it for you.
And I'll just piggyback one more thing, sorry. Going to what Al had said of our time in the legislature, the offices literally have formulas for what each of these different levels of outreach mean. A generic email means 5 constituents care about this, and I'm somewhat making up those numbers. A phone call means 10 people concerned. An in-person visit means 100 people are concerned, right? Like, they are extrapolating interest in the district based upon the volume of different types of contacts. There are formulas that they have. So the more people we have reaching out, it's not just that one person. That one person represents 10 people and when we get 1,000 people reaching out, that's 10,000, right? So this just grows and grows upon itself.
If I could add too, it's also not just this issue in a vacuum, right? So it's either this issue or nothing at all. legislative offices are hearing from dozens and dozens of people every day on issues that are of extreme need. In the healthcare field alone, they're hearing from people all the time, every day. So you have to be able to distinguish your voice from among all of theirs. So earlier when I was sort of giving you the visual of, you know, it can't just be on the list here, it's got to be up here. You have to think of it in the context that there's an entire volume of requests that are all trying to get to the top. So that's kind of where the competition is, and that's just only natural because there's a lot of needs. You know, one of the things that we hear about all the time in the budget is that in particular from the other healthcare sectors like the nursing homes and families that have members in nursing homes, or people that are advocating for clinics, or on the other side, they are out there, they're vocal, they're like the one-day event was on the rally, Julian, that you were on the steps and rallying everybody on this issue, you know, but they're doing it every day. So that's sort of that's what the challenge is. We need to make sure that people see this at that level of priority and need.
Thank you. We're going to move on to the legislation progress. I know Kathy can probably speak on this a little bit more. Could you just give everybody a brief overview of the current legislation that's been put forward by Mr. Rivera, and if there's any other in the pipeline that we're working on?
Sure. So he dropped a new bill, I think it was last Friday, bill number 9901, okay. All right, he dropped it on Friday.
A lot of nines.
Yeah, a lot of nines. And so what he's trying to do, first and foremost, is put a stop to the single FI contracting. Go Gustavo. Okay, so, but there are other layers to that. He wants licensure for fiscal intermediaries. He wants a one-time fee of $10,000 for that licensure. He wants to have a registry for the personal care aides, which would make some unions very happy to have. And he wants some training as well for those individuals. So that starts to begin to shift the complexion of the program as it has been so far. And it, for the moment, is the only legislation out there. The Assembly has not weighed in on this legislation, probably quite strategically. We are months before we're back in session and months before we start talking budget. So, you know, kudos to Senator Rivera for supporting us and putting that out there and kind of putting a stake in the sand and saying, here we are. We didn't agree with what happened in that budget, and here we're coming back. However, it's a process, and it's going to be months before the rest of the legislature engages on that. And I would certainly guarantee they're waiting until after Election Day, because this is kind of a lightning rod for them. But we've got to make our voices heard so they do act, so they do support, so they do understand we're not going away either. And as you know, Al referenced the rally that we had back during the budget. It was literally a matter of days while we pulled that piece together and had hundreds of people wandering the halls of the legislature, stopping in every office, talking to every single person they saw about, this is how it's going to affect me. Fiscal intermediaries sent their staffs. They were the people that were going to be personally impacted on this change. And it got noticed, and there was chanting in the hallway. It was very energizing, and legislatures were clearly behind us. And as Al said, many of them spoke up during the budget process to oppose this, but they weren't able to stop it. And this time around, we have to make sure they can stop it. So we'll continue to engage with Senator Rivera's office. We don't like everything that's in this bill, but the governor is going to demand compromise. She's not going to walk away and say, pretend I never did this. Let's go back to the way it was. We're going to have to give something up. And we are not quite clear on what that will be, but we'll continue to work through the details of this bill and see what we can gain from it and what we can lay aside.
And that's the importance. So we're in the room helping them write the bill so we know what's going on instead of leaving it to their own devices to write it on our behalf.
The time is short, so I just want to fast forward here to the current ad campaign that we're doing. Brian, if I can just ask you to give a brief overview of the current ads that have currently been out there, that have been published. I'm sure there are some agencies sitting here today that may never have saw those ads, where we can find them, where we can see them, and how we can assist in the fight and making sure those ads are all over every single social media platform.
Sure, thanks. If you have not seen the ads, they've been running, we're currently just went live with the third flight of ads, the third advertisement. The first one was back in June, beginning of summer, June, July, and it really highlighted just educate the public about what the issue is. Then we had what we called the Heather and Devlin ad, which was a mother and her daughter. Her daughter uses 24/7 care through CDPAP. And now we are out with the third ad that is, let's call it much more hard-hitting against the governor. I will say, in the vein of please step up, we need more money to make sure this ad is seen as wide as possible. If everyone in this room were able to give $25,000, we could go a long way in increasing the reach of this ad. We are currently spending what we spent in June on ads and running about 2/3 of the ads because there are a bunch of congressional campaigns that want to buy commercial time right now, and the cost of ads has skyrocketed. If you want to see the third ad, I think we might be showing it. I'm not positive. You can see it at protecthomecare.org. You can see all three of the ads there. But you can also see it tonight. Tune into the debate. Downstate, it will be right before or right after the debate because they were not accepting political ads during the debate. Upstate, it will actually be airing during the debate. That should drive the governor nuts. Fantastic. That's the point. And yeah, to the extent that we have additional resources, additional revenue, we can run more of these ads and flood the market. I know they did not think we would have the resources to pull this off. I can tell you that. They flat out told me, you'll never be able to do it. There were those in the industry who were suggesting we would never be able to do it. And the fact is we have run a multi-million-dollar ad campaign all summer because of many of you in this room and your peers throughout the industry who have stepped up and helped donate. The more resources we have, we can do additional things, call centers, we can do mail campaigns as well. We can layer additional pieces on top that will just help us further apply pressure to the governor and make her realize she can't get away from this. The general point of this ad campaign is not just to win the fight today. It is to make them feel pain and know, as Julian said, right? It's been 6-7 years that we've been dealing with this. I'm tired of it. I presume y'all are tired of it. At what point is enough enough? And if we do this and do it right, we don't just win this fight. We stop the next fights before they happen. And, that is where we are. That is the goal of this campaign. Go Protect Home Care. You can spread the ads out there on social media. You can spread the ads. You can spread the message. You can spread the campaign right to the governor and the like. But, please find myself, find Kathy, Al, Julian afterwards. We are more than happy to help you figure out how you can donate or how you can help in other ways. I will also throw out in relation to this campaign, we are trying to bring people to the Most Integrated Setting Coordinating Council meeting, which is the governor's meeting on disabilities and pulling the Olmstead plan together for New York. That is tomorrow in the Capitol Complex, the Empire State Plaza, on the 12th, Thursday at 10:15 at 1 Center Street. There will be a rally with several New York City Council members, so get your consumers, their workers out to that if you can. There's a lot of stuff going on, and money, people, bodies. I will say, possibly in that order. I am a child of the 90s, Wu-Tang, and cash rules everything around me, right? So, yeah, thank you.
Which video would you like to show? We got them up.
How about the third one, the one that's running right now? I don't know the name of it offhand. It's Kathy Hochul, Puppet Master.
All right, we're going to play one here. I think it's the third one. Obviously, we have the Heather one that's gained a lot of traction on social media. If everybody could just pay attention to the screen, we'll have that played now. And this is just a sample ad that we've put together.
But Albany politicians want to give control of New York's home care program to one out-of-state corporation. This reckless plan will take away choice for vulnerable New Yorkers, disrupt care, force elderly and disabled New Yorkers into nursing homes, and bankrupt 600 small businesses and nonprofits. Tell Albany, don't let big business hijack home care. Visit protecthomecare.org now.
Yeah. So that was the first ad in the campaign. The last one, those hands you saw at the end, actually have Governor Hochul. With those hands, they're no longer disembodied hands. They are the hands of the governor. And it names the governor. Governor Hochul wants to give home care to one out-of-state corporation. It is a much harder hitting piece.
All right, we're just going to play the last one now, the most recent one. And just a reminder, guys, these videos are already put together. The content is there. Now we need you. We need you. We need your staff. We need your consumers to share the word and help us continue the fight to victory.
Over 250,000 of the most vulnerable New Yorkers rely on consumer-directed home care. Yet Governor Kathy Hochul's Albany deal will outsource New York's home care program to one out-of-state corporation, slashing quality of care, forcing elderly and disabled into nursing homes, and cutting home care workers' jobs. A $40 billion deal with no comptroller oversight? Governor Kathy Hochul, stop hijacking our home care. Visit protecthomecare.org.
There's truly a lot of current marketing material that's already out there for everybody to see, and this is just a short, small glimpse of some of the work that the alliances have put together, the coalitions have put together, and with your help, we need every single agency here today to step up to the plate. For those that have already stepped up to the plate, to continue fighting, continue reaching out to other agencies. It's a small, close-knit industry. Everybody knows everybody. We would love, after the panel is closed in the next 15 or 20 minutes, if there are any agencies that would like to stick around and join the fight, if they can stick around and see any 5 of us here today, we'll be more than happy to get you set up there. And again, I just want to echo what Brian said. Not everything's about money. There are agencies that may not be in the position to give. There's still plenty that you guys can do. Whether it's reaching out to your PAs, your consumers, your office staff members, your local assemblymen, senators. Together we unite and together we fight. I think we should take maybe a couple of questions from the crowd. Do we have any questions? Who wants to be the first one? Don't be shy, don't bite. Somebody has to have questions. If you could just quickly introduce yourself.
Hi, I'm Sarah from Sarah Home Care. So I have a question right now that we are suffering for that, that Hochul did that cut of the rate cut. Now, they started the PMPM. So what's going on, this PMPM? Is going to be continue or we can hope something?
So that's to be seen. Right now it's, in court, right? There's lawsuits against the PMPM, right? So we have to just wait until that plays out, unfortunately. It's, that's where it is. And I can't really tell you what to do in this kind of setting.
Actually, in that case, we are losing our, customers. They are not happy. We cannot make them happy. very uncertain things going on right now. With all these, I think that all these provider, all these agencies are suffering same, I believe.
So one thing on the PMPM that is distinct, say, from the statewide fiscal intermediary, that was a change that was made administratively by the Department of Health. In the budget process, sometimes things are very well spelled out in the proposal of the governor or in what the legislature is going to do, and then a decision is made. We can all see it, right? It's visible to everybody. And we can see it to try to change it, eliminate it, support it if it's something good. But there are also things within the budget that are assumed to be within the authority of a state agency, in this case, like the Department of Health. And the Department of Health says, well, the Medicaid program will cost this much if we implement our plan, and the legislature says, all right, no, that sounds good. But meanwhile, behind the curtain are things like, this PMPM. And so what's really important, so in order to prevent something like that, the legislature has to proactively reach in and say, well, we think as part of your plan you want to do X, Y, Z. You can't do that. We're going to affirmatively prohibit you from doing that, or we're going to say the rules of the game. So what's important in that is for legislators to know up front, to be educated about, here's what the program is, here's what the program does. Oh, the department's talking about doing that. This is why it's important that you can't let that happen. So in this particular case, two proposals that were on the table. One was to eliminate the wage parity component of the payments for consumer directed. What was it, 400 million state and federal share. Of course, behind the curtain is the administrative cut. Just happened to be, $400 million or something, state and federal share. So when the legislature said, okay, well, we're going to prevent you from doing the wage parity cut, now you still have this other thing behind the curtain. And that's when the legislature has to act and say, no, you can't dismantle a program, for a cut like this, because that's what it's going to do. But just my last word on it. So Julian was talking about the rally, Kathy, Brian. It was great. It happened the way it happened. But what needs to happen all throughout the process is when we tell you there's a fire going on, it's time then to pick up the buckets, the hoses, and all that to put that fire out. Because at some point, if half the thing is already scorched, you can't go back and reclaim it. And the other thing I would say is that, you can't also look for somebody else to pick up the bucket and put the water on it. You all have to be willing to carry that and to do that, because in the end, if the cuts come, you have to look in the mirror too. Brian?
And this is also, I think, a strategic move by the governor's office to begin to cull the herd, and please forgive that expression, but that's what she's doing. She's trying to make it painfully apparent that she's not going to allow you to financially survive. And if some of you go away by the wayside while all of this other stuff unfolds by April 1, that makes their job easier, sadly, right? So everything Al said is correct. That's the way we have to fight it. But we also have to understand why they're doing it. We do hear from some people with, do they know that this is painful? Do they know? They know. They know. They did it on purpose. More noise. More noise.
You couldn't have said it better. More noise is really the key to success right now. I think from a legal perspective, we've done everything that we can. We filed the lawsuits. We've gathered many agencies together and unified them into both lawsuits, both the single FI and the PMPM lawsuit. And now is the point where we've kind of done our part on the legal side, and now we need to, like you mentioned, make noise, right? Whether that means showing up to rallies. Every single event that Governor Hochul attends, we have consumers, we have office staff members, we have caregivers outside, letting her know how painful this cut that was implemented 8/1 is, and how much more painful it will be should the SFI and the PMPM stick around. Let's take another question from the crowd. Anybody? Oh, I'm coming to you.
Hi, my name's Eileen Rabinowitz, and I work for Best Care. I would love to ask why she's doing this, but that's a very naive question, so put that to the side. But, you know, a lot of us are very good at tasks. Like, we know we have deadlines. Is there anything you could give us, like a cheat sheet, a fact sheet of all the rallies, everything going on? I mean, I know it's putting more on all of you, but if I had that, it would help me organize and get people to the rallies and get people writing the letters. And I don't mean to put more work on all of you because you're doing a great job, but I think that would be helpful to all of us who are busy covering cases or dealing with issues, and this might get pushed to the side.
So the rallies are not there. I can tell you, again, just to throw it out there, tomorrow in Albany at the Empire State Plaza, the most integrated setting coordinating council meeting, and then Thursday the 12th at 10:15 at 1 Center Street, the rally with city council members. But apart from that, templates, letters, the commercials, all of the information, protecthomecare.org is a one-stop shop that has all of the information to make phone calls, send letters, view the commercials, find out information, and the like. Everything you could possibly need is there. If there are things that you want on there that aren't there, tell us and we can make them. We will put them there because you're probably not the only one who could use it.
And just to echo on what Brian said, again, you know, the panelists up here and the staff members behind the fight, we're only one person. There's a lot of brains out here. There's a lot of different personalities, different techniques. If you believe that you have something to offer to the fight, whether it's, like you mentioned, posting the rally information, suggest it, open your mouth. We're here, we want to do more, and we ultimately will do more. Brian, would it be possible maybe if we can get the CD Panties to send out an email regarding these two next things?
Yeah, we sent out something on the MISC. I'm pretty sure we have sent out something specifically in New York City through our list, but we can get those over and have it for everyone here.
Awesome. I think that if we're able to put together some momentum going to these hearings and these meetings and these any opportunity we have to make some noise, it'll only gain momentum. We saw that in the SFI lawsuit. That was the first lawsuit where we only had a handful of agencies. We gained some momentum. The second lawsuit, we had more agencies. The third lawsuit, we had even more. So as more and more people step up to the plate and everybody sees the other agencies kind of, you know, stepping up and joining the fight, we will only have a much better chance in getting this done. Any other questions?
Thank you. Do you guys have the material in other languages so we can send the information to our members and the people that doesn't speak English?
I'm fairly certain we have something in Spanish on protecthomecare.org. If we don't, I can get it. I don't know that we have any other languages up there currently. But if there are languages that we could use, then let me know, and we can get those through.
I will just request that if you can do in another language is Bengali, because in Bengali we have a lot of population, and I think it will be much easier and much better. They can also, you know, sign up and say something.
And I'll say, I do know that if nothing else, you know, it's running through Chrome, which has the little translator button at the top, and you can drop and basically translate the entire page into any language Chrome will translate something into. So all of that will exist, but in terms of the template letters and things that are downloaded, I will verify that.
Thank you, Brian. And I will offer my personal assistance to any agency out there that needs help with translation. You can see me, you can get my email address, my cell phone number, and I will personally have it translated for you guys to send out to your members in the requested language. Time is short. We take another question. Anybody? All righty. This is going to be the last one before we wrap up.
Hi, I'm Leo Desa. I'm a consultant in the industry. here's the question that I have. With the managed care organization with the single FI, have we engaged them in here? Because if this happens, they'll only have one contract to deal with, one rate to negotiate with. What is their take in this? Have they put anything in it?
They're here today. Why don't you ask them? The people I've spoken to from the plans are against it just with us. They don't want to have that single negotiation point.
What are they putting in it is the question.
Why don't you go ask them, Leo?
I can say I was in a meeting in July with several other associations that had health plans in it with the Department of Health. Every single association spoke to the detriment of what was happening with the PMPM, the detriment with regard to the potential loss of FIs, the loss of services by patients and everything. It was pretty dire. The department, of course, just listened and sort of took it back. But, we tried to make them understand that they were going to imperil services if they went forward with this. We also pointed to the data in terms of where the cuts were going to have some of the most dramatic impacts. And in one of the areas, 4 certified agencies had closed within the last part of last year. That was an area of New York that was going to get hit the hardest in terms of these cuts. So, we were just, again, trying to build that case. And there was no difference really between what we were saying as providers or what plans were saying in the meeting. So I think that they're very, very concerned. But, again, everybody's trying to fight this on their own front, Yeah, Brian?
I just wanted to add, but Leo, you point to the one piece here that is kind of the elephant in the room to a certain extent, right? The plans have to offer CDPAP by law. They are going to have to contract with this singular state monopoly by law. That means this singular monopoly gets to pretty much set whatever price they want as a reimbursement. How that saves money, more or less $500 million, is beyond my understanding of how business negotiations work.
Just to echo on one of the questions that were asked about the health plans in the PMPM lawsuit, I know the Health Plan Alliance and the associations did put in some briefings, a letter of support, showing the damages and potential damages done to the plans and obviously trickle down to the agencies. Before we wrap up, is there anything else that any of the panelists would like to add here?
I wonder if we could ask the audience a question, just a second. So we've been talking about, communicating with your legislators and advocating and all that. Can we just see a show of hands? How many people here have ever called and asked something of their legislator or written and asked their legislator to do something? Okay, not bad. Probably 50% of the room. That's pretty good. Great. So if you've done it, that's great. You're comfortable. You know what to do. If you haven't done it, challenge yourself to make this the first time. And remember, they work for you. And that's just not like, it's not an offhanded comment. That's the reality. They work for you. So you're in the position of you're really their boss. So tell them what it is that you need. Tell them what's on fire for you. That's really the most effective way that you can message this.
And to that, right, is keeping the same message across all mouths, right? It gets very, very confusing, right? Because, just to throw an example out there, I think Michael was there. We went out to lunch and or dinner, and the person next to me was advocating cinnamon, spices, right? So they're getting healthcare, they're getting spices, they're getting police, they're getting jail, they're across the gambit, right? So you literally have to ensure that you're saying the same messaging, right? If all of us are aligned and everybody is on the same page, it's a very hard thing for people to ignore. But when they're getting mixed messages, they have an easy scapegoat and fall back onto, I was confused, right? So it's very important and very key that we have the unified messaging.
And I'm going to just quickly copy Al and ask a question of the room. How many of you within your systems have your consumers and their workers and know what assembly and senate district they are in? It doesn't cost a lot of money to run that through a database and learn what district all those people are in. And then when you go to meet with, let's say, Senator Rivera, tell him, I have 350 consumers in your district and 750 PAs who work for those consumers that live in your district. That means something. That tells them you are in their district, you are a part of their district. You have these tools. I will tell you, it is relatively inexpensive, like pennies on the dollar, to run these names through a system. It is an aggregator. They will just spit it back. These systems have HIPAA guidelines that you can get a BAA, and they will make sure that everything is HIPAA compliant, and they are destroying it once it's done. Get that data. Know where your consumers live, know where their PAs are, and know what Senate, Assembly, and Congressional district they are a part of. That is invaluable information.
And as a final note, I would say social media doesn't cost anything. It doesn't cost to like, share, click, and it's an easy way to increase our volume. So please engage.
Couldn't have said it any better. Social media is free. In today's society, in today's age, it's all about social media. We have the Instagrams, Facebook, Twitter, Telegram, whatever it is. If we, the agencies, supply our caregivers, supply our employees, supply our office staff with the tools that they need. So it's a simple text message. Hey, please share X, Y, and Z on any social media platform. It takes all of 4 seconds. Click, share, retweet, follow, repost, whatever the word might be. But we have, as an agency, every single agency sitting here, you have a tremendous amount of power. You have a power to reach thousands, hundreds, tens of thousands of individuals who can go and help us fight this fight. Now, one of the things, just a thought, Brian, if I can ask you, is there possible we can add a website or a software to our current website that will spit out the assembly in the district? Like if there's a software, maybe we can just put like a link up on the website so that agencies can come to our website and just kind of have really a one-stop shop.
I can look into it. I think those are generally data aggregator companies that do that. I don't know if I will look into it.
Awesome. I think that'll be a great idea. This way it kind of gives everybody, you know, really at your fingertips everything you need. And just to echo on what everybody's been saying here about your current elected officials in all the districts, it doesn't matter how many consumers you have. Obviously, the more gives you more buying power. But any consumer in any single district equals a vote. And election season is upon us. Everybody's trying to buy votes. Everyone's trying to do what's right for their constituents in their district. And we have the ability to get that message across. So collectively as an industry, we all need to come together. We all need to fight, and we will win. I am very confident. I've been confident since day one. We will win. With your help, we will kill it. And thank you again for everybody for joining. And like I offered before, if there's any agencies that need some assistance, need some help, would like to learn some more information, the five of us, I should say, will be here answering any questions, and I will be here for the remainder of the evening. Thank you again for attending, and we will win.
Let's go have a drink.